in 2017. Around the same time, the university also welcomed its first dean of the School of Dentistry, Dr. Rena. Her arrival in Utah had been anticipated since May of 2013, when she announced her departure from the Baylor College of Dentistry in Texas. Fortunately for us, Texas's loss is Utah's gain. It's my honor to introduce her to you today, but trying to list all of her many accomplishments would take a long time, and I want her to have time to talk with you. But I do want to tell you a few things about her that I thought were very interesting. Dean D'Souza is a clinician, a scientist, a professor, a researcher, a mentor, and a most capable leader. She has received 15 awards for teaching excellence and has received uninterrupted grant funding for her research for the past 23 years. She has served as president of the American Association for Dental Research and received the Distinguished Scientist Award from the International Association for Dental Research. A hallmark of her career is her ability to effectively mentor women at all stages of their careers. She has formalized an international network for women in dental careers that offers career development opportunities and mentoring for junior and mid-career women. Some of her priorities at the University of Utah are to develop a strong pipeline of female students and to recruit exemplary female faculty members who can serve as role models. It is my honor to have sat next to her, and one thing that is not on my paper that I think is worth noting is she sings a wonderful alto. That was just beautiful during our opening song today. The harmony up here was amazing. The addition of the dental school at the University of Utah is historic by all measures. And by the end of this year, the Ray and Noorda Oral Health Education Building will open in Research Park, and the dental school will move to its permanent home. We're so glad that you're here, Dean D'Souza, and we want to hear about your plans for the future of dentistry in Utah.
Thank you so much for inviting me here. This is it's almost like coming back home for me. And I hope I can add the proudest line on my CV, which is being a member of the Rotary Club Salt Lake City chapter. It's a chapter division. So I'm planning to do that. And it's not just because I sense from around the room the wealth of expertise and credentials. It's the spirit that you capture for me that symbolizes, I think, the spirit of the state and Salt Lake City, the spirit of giving, entrepreneurship, charity, kindness, really mean a lot to me, personally and professionally. So I think that is one reason. The other reason is that when I started my life in Houston 35 years ago, I was very active in the Rotary Club. With Dr. Robert Lee Ellis, who was one of their, I think he got the Lifelong Achievement Award for the Rotarians in Houston. And I worked very closely with him on many community projects. And so for me, it is coming back home because I separated from the Rotary as I try to build my career, raise my family. And now I have time to come back and revisit where I started. So it's a very special time. Thank you. If you looked around the room and you noticed the top right panel there, if you like to just slightly lower the there, you will look at yourself and you recognize that what distinguishes us as individual and unique human beings is our face and our smiles. And if you visited the 4th Street Homeless Clinic, you see very talented people who are in trouble for one reason or the other, missing a front tooth, or having a dental abscess swelling. It really hits you hard that smile that distinguishes us as unique themselves, it's actually connected to the rest of the body. And systemic diseases that are manifest in the mouth and dental diseases that have an effect on the systems are very well known today. So if you have a patient or any one of us suffers from diabetes, the chance that you would have periodontal disease, or if you have periodontal disease, that you would be very susceptible to diabetes is very true. So treating one oftentimes cures the other. And so that whole concept of oral health being important to overall health is extremely important. It's something I want each one of you to take home today as a message. So when we reach out to those who are underserved, who have needs, that establishing early on in a child's life the importance of good oral health, good nutrition, will really sustain that individual to a healthy life. And that is an investment I think the Rotary Club can make in collaboration with the School of Dentistry. What I want to do today is a picture that actually shows that connection between the heart and mouth, between gum disease, and many, many other conditions. I congratulate you because you are the 24th Rotary Club with a century of a legacy that is really unparalleled of goodwill and service. I went through the site and I absorbed as much as I could of the history. And what drew me to you today when I was thinking of how to set the framework for my talk was the fact that your missions, your prime purpose for getting together is so similar to what we chartered the School of Dentistry and the University of Bombay. To be serving, improving the lives of many through safe, quality, and affordable healthcare is at least at the center of the health sciences of the University of Bombay. Being able to network professionally to advance that goal is what you're here for. And if you look at the information exchange, the weekly programs that keep us always on top of what's going on, this part should be part of all our professional lives. And then finally, being able to promote relationships by opening up to diverse membership in terms of in every sense of the word, diverse in experiences and backgrounds, in gender diversity, race and ethnic are so important because the studies now point to the fact that the more heterogeneity you have, more likely the results are going to be more stable, more sustainable. It's just well proven through time. So I feel very connected in many ways. So some of you may wonder why Utah, and I had choices to make, and I came here because I thought that there was no other place to be. So there were schools that had 100-year plus histories in great cities. I had those offers on the table, and when I first visited, the beauty of the place, the majesty of the mountains, gave me a sense of peace and solitude. But it was the quality of the workforce at the University of Utah, the fact that this is a university like really no other, understated and quality attracted me. The fact that one could build a school from scratch so that dentistry would add and complete the health sciences and serve the citizens of Utah through that combination of interprofessional healthcare was extremely attractive. Because as you can imagine, if you go to a school with 100-year history, you inherit the baggage, the history, the attitude, and here we have a committed group of founding faculty that pioneered the development of the school for almost 30 years, Lynn Powell, Jay Allison, and Anson. And they set the stage for someone like me to come in with my skill set to take the school to be the top in the nation. And we have that opportunity. So in order to do that, I had to make sure that I knew that these particular points on the slide were in fact going to be embraced by the school. And so you can see here that we attract the best minds, so we can train the very best, most qualified student body in the country right now, so that we can give the most affordable and quality oral health care. We have to do that to distinguish ourselves from other schools, to do that by creating the knowledge. So we're not just graduating consumers. People, dentists are very technologically, we lean towards technology. We have sophisticated techniques and technologies. But there's much more science that needs to be done so that we can cure and prevent dental diseases that really rank among the most common infectious diseases in humankind. Dental decay and periodontitis, number 1 and 2. So all that combined creates this lofty vision. And the very last statement is one that I want to read out, that we are committed to ensure that the promises before us become reality and are available to all the citizens we serve. So we have promises, we have dreams, and I hope I can work with the team to get them met. Now, I just want to go through this quickly. Obviously, in order to get this done, I had to have some skill sets, and I did accumulate a few in my 34 years of being an academic, and it's, I would say, the most committed function amongst these things that I've learned to do well is my unflagging commitment to developing individuals to reach their fullest potential, mentoring women from all backgrounds, and actually everyone, is something at the core of my being a dean. And I think when you get to that point where the success of your mentees actually means a lot more to you than your own, you know it's time to step up and make a difference. And I know that each one of you in this room has experienced that sense before me. So it's not new to you. I came here, it also matters who you work for, right? When you get to this point, you say, I do want to be working for someone who I'm inspired by. And Vivian Reed certainly attracted me to the campus with her vision to transform the campus. And you can see there so well stated that there is any way that we can make something better. Let's find it and let's do it. And I was inspired by that because to me it meant everything that I stood for. I wanted to very quickly go over a broad sweep of the landscape, which by the way changed drastically in the last 11 months, both nationally and locally as well. To then go quickly to where we are today, progress and reflection, and then quickly chart a way in the future and how the Rotary Club and School of Dentistry can build a long-term, productive relationship. And as you know, in all of your businesses and niche areas, that people are at the heart of all we do. We're building right now at school, we're reaching out to the community, we're making connections, building bridges so that we can convert communities over so that we all unite for a common vision and goal. And all of that involves people. So this is how we began. The 30-year history resulted in a very intense startup period for me. We have a whiteboard ceremony and a lot of fanfare around the groundbreaking, and it was quite a historic moment for the state, and one in which I see a huge investment in oral health by declaring the first state-owned school of dentistry. But there was much more that went behind this, and it isn't just the local impact, it's the impact we have in the nation. So dentistry, in the last 25 years, opened up 50 new schools. Except for the University of Utah, all the other schools are for profit. Proprietary schools attached to osteopathic schools, typically not part of a major academic health center. These schools charge tuitions of about $100,000 a year, graduating dentists with debts above $500,000. And also, that John, we were talking about that. We were distinguished as being the only school in the nation to open up in 35 years with a charge to be a top-ranked school with the lowest tuition rate, the lowest tier in the nation. We charge $32,000 a year. So we have the chance to graduate individuals with the compassion and the spirit to give back, because they're not tied up with huge loans and having to struggle to be references. That's huge, but more than anything else, the school stands alone as being part of a major research and tech university. So we are planning to advance dentistry and healthcare through the creation of new knowledge. And it's that guiding my talk. So dentistry is a crossroads like healthcare is. Be part of it. In fact, Brent Lawson here is an expert and soon to be the president of the Utah Dental Association, leading this whole transformation of care. And we have to be thinking that with the changing times, that we have to educate our graduates prepared for the future. Not the way we studied 30 years ago, 20 years ago, but really dentists in the future. Dentists who look at a patient and see that connection and can work with physicians, nurses, physician assistants to create the very best care for patients. So this is the mission that we have, which for each of our constituent groups means that we offer quality care and the best education, the most safe and conducive environment for our faculty to develop into the best leaders of the field. And then, of course, to give back to the community in boundless measure. And even though we are not supported by the state, we're completely self-sustaining, dependent on that low tuition revenue rate alone right now, because our clinical revenues and our research revenues have not developed. Those streams will take a few years to build. have offered about $450,000 worth of charitable care just last year alone. And this is through our GPR program and facilities. So obviously we think, how do you begin, how do you start school? I mean, you're building clearly to find a flight because there's a class in place. So the first thing was to be able to make sure that our student population is top-notch, that we have the best educators. We don't have quality faculty, we can't have a quality school. So that meant reaching out to the nation, and I fortunately had the gift of being a magnet, of truly drawing attention to the youth and attracting the very best. And this being the result of that. Having the science guided on clinics very patient-centered and learner-focused, and being leaders in discovery and innovation. You'd like to know that our school building is in construction right now to be moved into December 1. It is a beautiful building at Bokhara and Foothill, right near the orthopedic center, and it's wedged between the orthopedic hospital and the occupational and physical therapy departments. So we have access to patients with special needs that come to the occupational and physical therapy departments that have very compromised oral health. And one of our goals is to start a special program to train our students and to also treat kids with special needs. And it's a huge area of need in our state, as you would remember, we still have the expertise. Right now, or dental capacity, but not necessarily the skill sets, because it is very different to be treating a child who is in a wheelchair and that can reach from hand to mouth easily. It's not very different. So over the year, scanning the landscape, pick the very best leaders. There is an organizational chart that I don't want to get into details, except to say I'm very proud of the team. It came from our local dentists who are leaders in the community. Some of these leaders came from outside the U, and some we simply are nurturing in-house. So there's a multi-pronged approach. The building is, because it's kind of in the research park area, requires that we stay connected with the communities of the university and also Salt Lake City. And I think we will do that effectively. This is our class of 17, that class that came in last August, now advanced into year 2. Very special class, the most qualified dental class in the nation. The average GPA 3.8. Right and a dedicated class that is very vested as the founding class of our school. And we did just as well for the next class of 18. We picked the very best. Now, one can say, do you really need 3.8s? Could we just have someone with a 3.5 or 3.6 so that we can actually vary our learning styles? And I favor that. But we only have 20 spots. And we are offering quality education. You can imagine how competitive it is. So our goal is to increase our class size through our state recruitments and working with the local community of dentists to increase. We have a capacity of 50. Because with 50, we can make a much larger impact, as you would expect. So we are currently reaching out to the region, because we hope to be the regional center for dental training of excellence. So we looked at our surrounding states, Wyoming, Montana, Idaho, New Mexico. They have no dental school. So that's one way to do it, is to reach out and create this sense that Utah is a place, a quality place to train. These kids will go back to their states and serve their communities. And we're expanding our mission and pipeline development. We hope to reach into inner city schools, and I know that you have very many good programs already in place, the third graders and fourth graders, where we can go and give oral health instruction, a fun presentation on the importance of good oral care and nutrition and holistic approach. But we also have the opportunity through the Rotary to reach out to schools, especially in rural Utah, where we can attract individuals who can come train and go back to serve the communities there. There's a huge need for dental care in rural communities in Utah. I've done that homework and done the analysis. We are currently developing a curriculum that is top-notch. It is going to be a state-of-the-art. It's still building years 3 to 4, but it involves this integrated kind of not teach in a silo, but bring in business principles so that the DDS graduating has more than just a business 101 sense. They actually understand how to manage loans, and how to buy practices. We have business principles, legal principles, all incorporated into dentistry, into the health sciences. And this is basically what the concept map was that our faculty and staff and students proposed to be innovative and challenging. All of this is new. The curriculum is meant to be such that we create in our students three important characteristics. Number one, that they're technically master clinicians. They just know they're very good at what they do clinically, but they're also critical thinkers that can assess good from bad as products come through the office, as they see controversial things emerging in the field. And most importantly, so if you have good hands and you've got a great mind, that you have a heart that is compassionate and wants to give back. So those are the three body parts we're focusing on. And so I must say I'm very pleased. We started off with 4 faculty. We have actually 40 on board this August. Top quality faculty that have come on board to teach LTBS class. We've also recruited staff members and made sure that the faculty represent the community that we serve so that we can have role models that can then attract students from different backgrounds. So we create a workforce that matches the need of our diverse, increasingly diverse community in Utah. We're predicted to be almost 14% Hispanic. 50% of our school children in Salt Lake City are of Hispanic background. The most common reason to be missing school is a toothache. So you take that all together, it means that we have to be doing something that makes a difference. A good quality staff, an Office of Academic Affairs so we can create this lifelong learning path for our faculty, because we can never learn enough. Technology and science is moving so fast, as is the government with different kinds of reform, that we have to change the attitudes of, and our students have to be prepared for not just entering solo practices, but to be part of community-based practices and group practices, seeming to be the trend nationally. So we're developing right now students, the center of our institution, the most important asset is our students. And so we're building our student programs from scratch to afford them the opportunity to become who they were meant to be. And we have everything in place to allow them the wiggle room to adjust beyond the prescribed curriculum that we all have to go through. I'm so thrilled that Jim Becker on board. He's very active in the LDS community and church. Is a state president, but he's also president of the Utah Dental Association. And Jim is a pediatric dentist who really has found an associate to take over his practice and came forth to help. So he's my right hand dean for clinical affairs, and will be hopefully meeting you as well and driving excellence in that area. How do we pick a research area when there's so much available? Well, the U is noted to be #1 for entrepreneurship and innovation in the country. This surprised me because Stanford and MIT are so aggressive. But the University of Utah is #1. And I've checked that in the last 5 or 6 years, except for 1 year when MIT took over. For having the largest number of startup companies and innovation on campus. So keeping that in mind, our focus is going to be to develop a research center of clinical research that is going to change the way we practice dentistry by introducing new treatments, new devices, new materials. If you look at what we put in the mouth, you would know that there's nothing that is actually natural right now. Everything we put is metal or plastic or acrylic, right? Those of you that have been to dentistry. So the need for us to develop a new wave of natural materials that are biologically compatible is huge. And we have the capacity to do that. We also have, just to let you know, a very strong commitment to drug addiction and substance abuse. We have the largest funded program in the School of Dentistry, led by Ben Hansen and his team. So we have that center already developing, and we hope to reach out in a much more a broader way to reach out to communities. We understand the science. We're developing therapies for cocaine and connect addiction. We understand how that actually happens in the brain, and we're taking it all the way to affording treatment and care to those that are addicted. So we have this whole spectrum of care, from basic research to clinical applications in place. And again, you know that there's a huge need to that, to develop in the state. What this should translate, I think, to us getting a lot of attention and funds from different agencies in the US at a tough time in our economy, very tough competitive grants. But I think by doing that, we can rank in the top 5 in the nation if we simply cross those margins and establish ourselves as a center of excellence. So on the development side, we've done reach out. We were fortunate to get Zions, who came forward totally on his own, Scott Anderson, to give us full-ride tuition scholarships for students who are both needy and meritorious. Scott has also made the commitment to fund a mobile van, because I've said that we absolutely need to get care to the rural areas of Utah. Now, mobile van provides episodic care. It's not necessarily the most wise way to give continual care, but it could serve a purpose for the interim. The concept of engaging our own clinicians in different parts of the state to do community health care and have the school send its students and its faculty to serve those clinics is just as appealing. But that is a project that's right up on the top, and with Zion's basic support, getting help from any other entities would make it a reality sooner. We have our students, I have a picture of that. Also cover the homeless clinic, Montezuma Creek, Greenwood Clinic. They're out in many other areas, both the residents and our dental students. And I think the more we have and expand the manpower team, the more we can outreach. Because every time our students are out, we lose income in the school from all the revenues we would generate from seeing patients coming to the school dentistry. So it's a balancing act that we have to achieve. Now, last year, around about October, I was very grateful to get the help of Peter Committee with Senator Pat Brown and others, and created a concurrent resolution that was passed on the floor. And that simply said, right here, that the School of Dentistry is committed to serving the underserved, and I wanted that accepted and on the record, and that we would do so by engaging communities and different coalitions around the state to make that happen. We can't do it on our own, obviously. So I just wanted to know that that was on the table. And with that comes our action item to serve communities so far in this group. Give Kids a Smile has been a tradition for the city, and we've only been able to serve a small fragment of kids because we have very small venues with a few chairs. But now we have 83 chairs at the School of Dentistry, which we will open up for Give Kids a Smile and the Seasons program as well. And of course, the special needs patients working with the United Way and the Oral Health Coalition is important, and all the other venues that we serve. So where did I see this going? I wanted to have a very open and transparent discussion. I have a set of business cards so that I can keep in touch with you on individual level, and that's wonderful people way. Is to map out, of course, and by being part of the Rotary and being engaged in the committee, I think I would learn the best and learn the quickest that way. But if you think of the projects that we could do together, it would be joint sponsorships, anything that would appeal to you, that would especially give a child hope to have a healthy life. Any part of the state, any place, that would be the guiding principle. We can make a difference by truly using the mouth as an entryway to the rest of the body. I think we would have done very well. But there's also another vulnerable population that's very neglected, and that is our elderly in the state. If you go to a senior facility, you know that when you don't have your teeth and you have a long list of conditions and drugs that you take, it's not healthy. And dentists coming in a mobile van facility, going over to these senior care facilities would be a wonderful way to add dignity and good health to those lives. And I feel that so on the opposite end of the spectrum, we have two very vulnerable populations, and not to mention those in between who also need care. I would like to make the school's expertise available if you at any time want me to come by or any one of our faculty to talk about a specific topic of interest. The connection between periodontal disease and diabetes, or community health or anything like that, please feel free to do that because I will be here. And if not, any one of our family are committed to this cause. So in the end, this is the team that comes. Here we are with some of the founding faculty. Lynn Powell to my left and Gary Lowry to my right. As we inspected the school building just a few days ago, and it's a truly uplifting experience. It's a school that's going to be physically the most beautiful school, but inside will also be that top quality. And I think matching the beauty in and out is going to be key. So I wanted to end there, thanking you, open to any questions, and to a long-term love affair, which I hope to have get into each one of you. Thank you.
Is it common to have such a disparity between male students in dental school and female?
Yes. Is it common to have such a disparity between male and female enrollment? So in Utah, we have 1,800 dentists approximately, 1780, of which there are only 25 women. Now that's expected. Because if you look at the culture of the society in Utah for many years, women were encouraged to be more, go into dental hygiene. So you see obviously a lot of women hygienists, and being primarily at home, that was not an expectation. The world has changed around the country. We have about a 52% enrollment of women in all dental schools. But if you look at the percentage, this changed only in 2001. Before that, it was mainly men, it was mostly male. So if you look at 2000 plus, women entered the workforce then. So what appears as a statistic, 52% enrollment, but only 24% in the overall population in the US are women practicing dentistry. Because that trend is now going to increase and go up. So compared to that, of course, we are very low. Wonderful opportunities. We've now got 6 students in the class of 20 for our class of 18 who are female. So that's an upward trajectory. We are going to build outreach programs, develop pipelines, and also to use our women dentists to get the help in serving as mentors. And I think both men and women, female dentists are committed to seeing that distribution of the workforce. I'm not biased, but I think women have a natural compassion and empathy, small hands. I have experienced pain. That distinguishes us, right, but not necessarily make us better dentists, but I think we're equipped to be very compassionate chairside. So, yes.
What percentage of your budget comes from the state of Utah?
Close to 0. What percentage of the state budget comes from Utah? Of our budget comes from the state. So, to be honest, out of just 500,000 that is only slated for a few years as part of the exchange program, we used to train students for 1 year and then send them for years 2 to 4 to other schools, and more recently to Creighton in Nebraska. And because of that exchange, the state gave us money to attract those students back to Utah and help them, launch their practices. So that is on the books the only support we get from the state. And it's only for a few years. So we are completely self-sustaining. So for me, as a dean, means that we have to have our clinics designed with a great business model and yet be compassionate so we provide care that is affordable. But care that is also unique and special, that maybe no one else provides. The special cases that are complex, etc. Our research revenues are typically neutral, because it costs a lot to maintain research labs, but we can maybe draw a little bit from there. Tuition, I'm not keen to increase our tuition rates, that we match our school down the street. Is really the main revenue stream that I think will help us grow. Yeah.
Question?
Yes.
Yes. I saw a series periodical letter to editor Florida sitting the other day.
Yes.
And there's a comment on that, please.
It is, so this is the issue with fluoride. So when it was first introduced, it was one of the most successful public health experiments ever done in the history of mankind, because you just had to put this little chemical in that was really non-toxic and would attach to the tooth, the enamel, and make the enamel resistant to decay. The controversy lies that if you have too much fluoride in your body, your bones and they get brittle. The evidence doesn't suggest that that's actually happening, but it's extreme cases that will cause that condition. So the recommended dosage of fluoride in public fluoridated water supplies is 1 part per million is ideal. 0.7, so it's dropped now. So 0.7, and there are times when you can have a little more in that water, and you're also taking fluoride supplements, or giving a child vitamins and with a fluoride supplement. So states like Oregon, states that are very driven towards natural, eco-friendly systems, have taken an extreme position on fluoride. The science supports that it's absolutely beneficial and essential. So so I know there are some districts in Utah that are concerned about this issue, but the World Health Organization and the Federation of Dental International, that really scope out the whole big picture, feel that fluoride is a necessary supplement. Yeah. And I'll be around to chat actually.
It surprises me that Utah doesn't have a dental school. And it's just coming on, so I applaud that. But why has BYU, and why are we just that far behind in the academics?
So for years, there were 2 amazing statistics. BYU has produced the most qualified pipeline of dental students for the nation. If you pick a phone and call the dean for UCSF, Seattle, NYU, Columbia, and ask them, who are your top ranking students? They always BYU, associated with Utah, right? So that was the trend. We were sending out approximately 170 students to other schools in the nation for a long, long time. Why we didn't have a school here? I mean, would you have a better, would it be the private sector?
I think it's because we've been so successful educating students outside of the state.
That you didn't think it was worth, the investment and the expense running down school kind of didn't appear like it was worth it. I can see that, yeah.
Thank you very much.
We love you.